Thank you very much. As you can see, we have some Marines from Toys for Tots that'll talk in a couple minutes about the toy drive here in the city, in the state, and I'll get into that in a minute. I'm going to start with the COVID case numbers, the most up-to-date cases that we have, and the numbers that were as of yesterday. I think was reported yesterday, we had 4,613 new confirmed cases in Massachusetts yesterday. 46 new deaths were reported in Massachusetts yesterday. In Boston, we had 418 new confirmed cases in the city of Boston. We had no new deaths confirmed yesterday. We did have 6 deaths that were previously reported, so our total death rate in Boston from the beginning of the virus is 925 people have lost their life due to COVID-19. And our prayers go out to the families that are sick and suffering, and also families that have lost their loved ones. We'll let you know that you're in our thoughts and prayers during this holiday season. The testing data for the week ending November 26th, and this is now 3 more days from the last time I gave the report, so we go back 7 days from the 26th. We had an average of 4,570 new tests per day. That's down a little bit from the previous week, and we had said that the previous week people were getting tested to travel, and the week after we're seeing a few fewer tests. That does not include college testing. The average number of positive tests for each day for Boston residents was 195. That's up slightly from a few days earlier. Our current community positive rate was 3.9%, and that's also begun to see an uptick, a bit of an uptick. Dorchester, East Boston, Hyde Park remains the neighborhoods with the highest positivity rate. Last week they were between 7.7% and 7.8%. After a couple of weeks of reduced capacity, and as I said here when I stood here for the last couple of press conferences, a little excited about, not excited, but happy about the trend. We are seeing an uptick, a significant uptick, quite honestly, in the last couple of days. In the last 2 days alone in Boston, we've had 825 new cases of coronavirus. Yesterday's number for Massachusetts was the highest since the pandemic began. In addition, we're seeing more patients being admitted to Boston hospitals during COVID-19, and this is just in the last couple of days. Since Friday, we've seen an increase of about 70 patients. Yesterday, we saw an increase of 5 patients being moved into intensive care unit beds. These are folks that got the virus, got sick, got put in the hospital, and now are in intensive care beds. So we're seeing increases virally around all different activities. We're seeing the impact of the activities with people getting seriously ill. We're going to be monitoring this data closely and looking at what resources that we can bring as a city, obviously, and then we're going to be working with the hospitals and whatever we need to do to try and keep those numbers down. In the meantime, we need everyone to help stop the spread of the virus. Lots of people did Thanksgiving, and lots of people did Thanksgiving like I did and other people did with just the immediate family. But other people traveled. Other people had gatherings at the house. And we're seeing the impact of those gatherings. Why we had the highest day, I believe it was the highest day in the state since coronavirus started. And while we've seen 825 cases in the last 2 days. We need to be serious about this virus. We need to take it very seriously. We need people to be wearing face coverings. Cover your nose and your mouth when you're outside your home. We're asking you to wash your hands frequently throughout the day with soap and warm water. Use hand sanitizer. We're asking you to clean and disinfect your surroundings. If you're working in an office or if you're working on a job site, clean down the site. Make sure it's clean. We're asking people to take precautions not just in your home but also in your workplace, those people that are going to work. If you're an employer, if you could, make sure your workers have all that they need to be safe. Make sure people are doing physical social distancing. People shouldn't be eating cafeterias. There should be no common areas for food, things like that. If people want to work from home, allow people to work from home as much as possible. We're asking seniors, please continue to take the extra care and caution. Stay at home as much as possible. Again, I don't want to be standing here and talking like this. I'd rather be talking about something new, about reopening. But right now, when we look at these numbers, that's not a conversation that we're going to be having anytime this week and potentially anytime next week. We need to continue to take this virus very seriously. I'm asking everyone again to get tested. If you have a reason to think that you've been exposed to COVID-19, we're asking you to get tested right away. If you travel for Thanksgiving or we're in gatherings larger than in your households, we're asking you to get tested as soon as possible. Getting tested before going away for Thanksgiving does not help you against the coronavirus. We need to make sure that while you are away, you're able to take care of yourself as well. If you haven't been tested before or you haven't been tested in a while, we're asking people to get tested now. Currently in Boston, and this is just Boston and other cities and towns have it, we have 30 testing sites throughout the city. You can find them listed and mapped at boston.gov/coronavirus, or you can call 311. We continue to expand our testing capacity, especially in our communities with the highest rate of infection. Our free mobile testing sites this week are in East Boston in Central Square Park, Roxbury at the Washington Mall, Jamaica Plain at the Anna Coles Community Center. This site is open through 7 o'clock this evening and will continue into next week. So we're going to continue to be updating everyone on more information, time, and dates when these facilities are going to be open. We're going to continue to invest in free mobile testing sites and bring them to the neighborhoods where the COVID activity is the highest, so we can make sure that people who are living in areas that have high rates of COVID, we want to make sure that you feel safe and that you get tested. Our mobile sites are free and open to anyone, regardless of whether you have COVID symptoms or not. We're going to continue to provide supports for our small businesses and our residents impacted by COVID-19. There's one program that I want to highlight that is a great benefit for seniors, and that's our senior homeowners, any senior citizen that owns your own home. It's called Senior Saves. It helps residents over the age of 60 replace your home heating system. With the cold weather approaching, we want to make sure that older Bostonians can stay warm, especially because we want them to be able to stay inside their homes and stay safe from COVID-19. We created this program in 2014. We've served over 220 senior citizens with new heating systems in their home. The company's doing an amazing job in bringing in the new boilers and new heating systems and quite honestly cleaning up a lot of the pipes and clutter in your basement. This year we've more than doubled the amount of funding that we can get. We're now providing grants up to $8,000 for income-eligible seniors. That's up from what was $3,500. The cost of replacing your heating system has gone up, so we've made sure that the program reflects that increase. New energy-efficient systems will lower the risk of heating emergencies during cold winter and cold weather. It will also help you cut your electricity, your energy bills. So when you think about your bills and the cost there, with old systems, sometimes that old system pumps out a lot of heat, but it's also pumping out a lot of cost for you. I encourage you to look into this program before the weather gets too cold. I know that we're going to have a pretty cold next couple of days here, but we're getting these bursts of 50-degree days in here. So if you can contact the City of Boston, contact our Boston Home Center, we can help you. You can do it a couple different ways. You can call 617-635-HOME or visit boston.gov/DND, or just simply call 311, and you can call the Age Strong Commission, and they can help you guide the way into these programs. Today I also have another announcement that's important to seniors and everyone regarding their electricity bill. We are rolling out our Community Choice Electricity Program. This is our policy to combine the buying power of Boston's homes and businesses to get more stable, affordable electricity rates and bring more clean energy into our city. It's an important part of our climate action strategy to become a carbon neutral and protect our environment. As we designed it in partnership with the community and advocates with the goal of saving residents money and giving them more choices. Tomorrow we're going to begin sending notices to residents who are enrolled in Eversource Basic Service. That notice lets you know that you're being enrolled in clean energy programs starting on February 1st. You don't have to do anything to get that benefit and be part of the program. It also tells you your options and lets you easily opt out if you want to stay in your current plan. We're also providing discounts for 20,000 low-income residents through a solar energy program. For anyone who wants to learn more about Community Choice Electricity or how it works, we're also going to have starting Monday, December 14th, the Environment Department will be hosting a series of 11 online webinars translated into 10 different languages. I want to thank all of our partners on these programs and our staff who've worked extremely hard to build this policy. This will be the largest municipal aggregation program in New England and one of the largest in the United States of America. We're proud of how it advances our climate goals by putting choice and savings in our residents' hands. We have some holiday news. We all need some holiday cheer this year. There's no doubt about that. So we put trees up in every neighborhood in the familiar locations that we've done. We couldn't have in-person events this year. We usually go around Mayor's tree lighting holiday weekends and light all the trees up. We couldn't do it this year, but they are lit up as usual, along with the Commonwealth Mall, Copley Square tree, and the big one on Boston Common. I encourage everyone to take a walk and view them in the different neighborhoods that you have. The tree in the Common is an annual gift from the Canadian province of Nova Scotia. The tradition began as a token of thanks for Boston's assistance after the Halifax explosion of 1917, when 1,800 people lost their life. This Sunday marks the 103rd anniversary of that day. This year, the tree is dedicated to healthcare workers who stepped up in 1917 to help the people of Halifax, Nova Scotia, and have worked incredibly hard to save lives this year. Usually, we have thousands of people on the Common lighting the Christmas tree, and we can't do it this year. We have folks that come down from Halifax to watch us the tree, and they celebrate with us. Yesterday I spoke to Mayor Mike Savage, and we are committed to preserving this tradition. In fact, there's a tree lighting that's going to be broadcast tonight on Channel 5, 7 o'clock. We'll have great performances, including the Boston Pops, the Boston's Gay Men's Chorus, an actor from the show Hamilton, performers from Nova Scotia. The headliner is a Grammy award-winning artist, Shaggy. So I encourage everyone to tune in to a great show tonight, and encourage you to celebrate the holidays and get a little bit of normalcy in our lives as we close out this year 2020. The reality is that many families are going to be struggling through this holiday season. I heard a woman last night on one of the news stations talking about her concern about not being able to provide necessities and toys for her family. The needs in our community are greater than they have been in a long time. We saw it last week with Thanksgiving. We've seen it, quite honestly, for the last 9 months with the COVID-19 crisis. More families are having a harder time just meeting the basic needs. But buying toys and gifts is going to be beyond that for many, many families in our city. I would ask everyone to take a moment to think about what those families are facing. Whether it's a mom or a grandparent or whoever's raising the child, we want everyone to experience Christmas the way that we can try and make it happen. We need to continue to bring magic and joy into families' houses, especially during these hard times. Many people, I'll give it 1 second, there's an ambulance going by. Many families are wondering struggling how they're going to get by day right now in our city. And certainly many of them are thinking about Christmas or the holidays they celebrate and what's that reality going to be for their child. And that's why I'm grateful to be joined today by representatives from Toys for Tots. It's an annual toy drive led by the United States Marine Corps. In the city of Boston, we work with Toys for Tots because they have an incredible history and track record in our community and across our country of helping children have a very special holiday. If you've donated a new or unwrapped toy in the past, chances your donation went to Toys for Tots. If you've been to a holiday party with gifts for needy families, chances those gifts were provided by Toys for Tots. This doesn't happen by magic, and it doesn't happen by accident. It takes a lot of hard work by a lot of dedicated volunteers and the United States Marine Corps. Usually I would be joining them at a warehouse in South Boston for a big kickoff. This year, there are challenges. We haven't been able to do in-person toy drives, and we're not going to be able to do in-person toy drives. Lots of workplaces that would be donating boxes of toys are closed, or they have just a few people in the offices. So we need to work harder this year. We need to work harder than ever to make sure Toys for Tots meets their goals. In the city, we're going to have donation boxes here at City Hall. We're going to have donation boxes at all of our firehouses, at our standalone BCYF community centers, at the City of Boston Credit Union locations, and if we need to add more locations, we will. We're also going to be supporting their operation whatever way we can. I'm pleased to be joined by some of the people who make an incredible difference in this program and do some work. We have the Marine officers, including Staff Sergeant Howard Brown, who's going to come up here in a minute and talk. We have our Veterans Commissioner, Rob Santiago's here. We have Darren Howell, who's worked for Toys for Tots on holidays and families impacted by violence and as their civilian coordinator. He's done this for many, many years. And it's just an incredible organization. We have Boston police officers, Boston Fire Department. We have volunteers. There's probably volunteers there right now, probably not social distance, but they're there working the table, our ladies. I want to thank them for being there. But I'd like to ask Staff Sergeant Brown to come up and say a few words about Toys for Tots and how we can help as a public. And quite honestly, the press can help by getting the word out. Staff Sergeant Brown.
Good afternoon. Thank you for this opportunity. Mayor Walsh, I greatly appreciate the opportunity for being able to come here today and just get everyone the update and the word of what we have going on in Toys for Tots. I also want to thank the City Hall staff for making this possible. A couple of organizations, U-Haul, Enterprise, Local Motion Bus Corporation, Local Motion of Boston, Carlo's Sub Shop. The locations here, they help us be able to do what we do on a daily basis and help sustain my volunteers. I've had a core group of volunteers of about seven to nine, and about 3 to 5 of us based on varying schedules are in at a time. As you can tell, the volunteer numbers are very short, and it's very understandable because of course this is a very cautious time, very dangerous time, but we have taken precautions to receive volunteers, whomever is willing to go and dedicate their time, receive them safely, ensure that everybody is checked appropriately before they come in and volunteer. Anything that can be provided this year in the form of monetary donations, toy donations will be greatly appreciated. It's not about us, and it's not about looking good, it's about doing good. During this time frame, these 3 months, is one of the tightest times and the toughest times that we need to come together and be a family. We're stronger together than we are apart, and I just ask that whatever is able to be provided, don't be afraid. We're doing all we can to go ahead and be safe, and know that what you do is not in vain. There is a family member or someone else's family member that greatly appreciates it and needs all these opportunities that you provide to them. Thank you very much for your time, and have a great day.
Thank you, Staff Sergeant Brown. Thank you for all your work you do as well, and thank you for the work you do protecting our country. With that, I'm going to open up for questions. If you have any questions for Toys for Tots, also please ask them.
About this recent significant uptick, I know usually you look at data over a longer period of time than just a couple days, but it seems pretty significant.
Yeah, I'm pretty concerned. I think if when Marty Martinez gives me the numbers from yesterday, if we're in the 400 range, I'm going to be very concerned. I mean, we've had 2 weeks of lowering numbers, and I was encouraged by that, and our numbers went down to an average, I think, 185 per day, which is great, and we're moving in the right direction. With 4 days ago, we're talking about opening schools and keeping restaurants open, and today it's in the back of our mind what happens now if these numbers continue to go up. So I have some major concerns, and the biggest part of my concern is coming from hospitalization and seeing that number go up.
Any sort of possible rollback for reopening?
Not at this particular moment, but we can do that pretty much on a moment's notice. We've gotten used to that now, but we are going to monitor these numbers pretty closely. The testing is important to get those testing numbers up again. We have a drop from Wednesday to today of people taking tests, so we need you to get tested. We need people to go out and get tested. I know it's a little cold today, but go out and get tested.
Are there any new steps the city's looking to take to try to get some people tested and try to
Yeah, the question is any new steps the city's taken. I mean, to be honest with you, there's not much more we can take. I mean, we have a curfew in place that from 10 to 5 in the morning. We have a mask order that people wear masks. We're asking people to wash your hands and physical social distance. Our schools are closed right now. There were people out here yesterday protesting, upset because schools aren't open, and I hear their concern, and I want to be open too. Our hotels, for the most part, people aren't visiting. We have restaurants that it's only a portion of people that can go into them. There's not much more we can do other than shut everything down, and that's the last resort. And we're really asking people to, it's within our own power. I mean, this virus, if you're around somebody that has the virus, then you need to self-quarantine. If you're not in that particular situation where that happens, meaning if you're at work and you get the virus and somebody has it at work, I can say, okay, I can understand that. But if you have a house party with 20 people in it and you pass the virus around, I don't understand that. Like, I just don't get that right now, because we're asking you not to do that. I mean, it just doesn't make sense right now. And I think that we have to continue. It's incumbent upon all of us. I mean, the next step is shutting everything down. That's the next step, and we've done that before. And we're 3 weeks away from Christmas. Our retailers need people to go in and shop in. Our restaurants need people to eat in. People working, they need to make money. I mean, that's the last resort, is wanting to shut things down. But if these numbers continue to go up, and we see, in maybe Tuesday I'm standing here, I could be talking about putting plans down for shutting things down. Hopefully Tuesday I'm talking about we're seeing the number go the other way again. We'll see.
Mayor, what are you doing with the city to prepare for the arrival of the vaccine, as we understand it, mid-month, to get it distributed? How do you see that rolling out? And what should people who want to get the vaccine be doing to prepare for when that comes?
Yeah, I'm going to ask Marty Martinez to come up and maybe talk a little about that. It's going to, as he come on up, Marty. It's going to go through the state's DPH into the local public health departments. But let me have Marty kind of give a little better update than I would have.
Thanks, Mayor. Yeah, I mean, we are currently working in partnership with the state on their efforts around planning for the vaccine. So the federal government has started to release some guidelines on prioritization, some guidelines that then will be passed down to the state. The state's in the process right now of finalizing their own plan to send to the federal government of how distribution will happen. And the local Board of Health and the local city, our effort is to make sure that we mobilize the community to not only want to get the vaccine, but to also build trust in the vaccine, which is going to be a really important piece for people to realize that it is safe, that it's been tested, and we need to make sure we're communicating that message and that people will have access. So we're not only planning for distribution, but we're also planning in partnership with our community-based organizations and other community leaders to really make sure we get messaging out into the community about the vaccine when it comes, so we can really distribute it widely.
People, hospital people, medical people will be first in line to get it. Are they being required to get it, or do they have an option?
So the question is, we're hearing who's prioritized: first responders, public health, healthcare workers, and are first in line, and will they be required to get it? All of that is still being figured out on not only the prioritization and what does it mean to be a healthcare worker, but it's also figuring out how it'll be accessible and how people will be asked to try to get the vaccine. Mandating the vaccine is not going to get enough people vaccinated. It's really going to have to be to build trust in the community to get people to want to get the vaccine. It's going to have to be an effort to really make sure the community feels confident in it, and all those plans are still being worked through.
Mayor, some new guidance came out from the CDC saying basically that people over 65 should not be in enclosed places where others are not wearing masks. Now that Boston has no outside dining, we only have indoor restaurants right now. Does that basically mean if you're over 65, you shouldn't be in a Boston restaurant?
I think if you're over 65, you shouldn't be in a restaurant. I think if you're over 65, you shouldn't go to certain spaces. I mean, that's been a consistent message since the beginning of COVID-19. I think that you have to make a judgment call on that. I think you have to be very careful. It's not just about what the CDC said this past week. That's been the message that we've been saying from the very beginning. And also not just over 65. If you have health issues. If you have breathing issues and health issues, you shouldn't put yourself in those situations either. I think you really need to make a call right now. It's a personal call right now to put yourself in a situation that you don't want to be in to get this virus. This virus is still deadly. The CDC said yesterday that we could have as high as 450,000 Americans dead by February. I think we're at 272,000 right now. That's a lot of people that are alive right now that could die because of the virus that don't have the virus. So you need to take very special precautions for yourself, for your own personal health.
And what about the BCEC? The governor announced today that there's also going to be a second field hospital set up in Lowell. How close is the BCEC to being a field hospital once again?
Think about this. Worcester 2 weeks ago, Lowell this week. I mean, we're right behind. And we'll get up quick. We did it in 5 days. Last time we have the materials over there, we're able to put a hospital, literally build a hospital in 5 days. But I think it goes back to the question was asked earlier that by Tuesday we could be building a field hospital, or by Tuesday we could be talking about numbers getting better in this region. So it really is. Listen, the numbers are going to go up. We're going to see numbers in coronavirus for the next week going up. Now the choice is, as the numbers increase, do we want to keep the number increasing to a smaller number, meaning that not spreading the virus? So anyone that traveled during Thanksgiving, you should get tested before you go around anybody. Because what's happening is these cases of people that are getting sick, most of them, a lot of them, not most, a lot of people went traveling for the holidays and didn't realize they had the virus, and they came down with the virus. So you're walking out there and you might have went to your house in New Hampshire or down the Cape or party with friends, and you have the virus and you're spreading it all over the place, not intentionally. So we're asking people, we need to get tested, and if you're at a certain age, or anyone, quite honestly, we should just be careful.
Are you still seeing a lot of gatherings, getting on complete gatherings?
I mean, I haven't heard any complaints. Like, I'm sure we get some complaints. I haven't heard of any, but I know it's happening. I mean, you can just tell. It just the numbers are just too high. 400 to 825. I think, as I said, in 2 days. That's a lot of cases. Like, we haven't seen a 2-day increase, something maybe since April. And the feel I'm getting here is that these numbers could exceed what we saw in April and May. And then we have real problems.
Can we hear from Toys for Tots just on you're here for the Toys for Tots and Tots?
Oh, yeah.
Just on one other thing?
Yeah, come on. That's fine.
What's the greatest need in terms of toys?
The greatest need in terms of toys, typically it's the older girls, the 7 and up. Overall, the older population of the kids are typically the ones that we run out of the most, but usually the older girls are the one that we see the shortage in the fastest, sir.
I think the staff sergeant's being respectful. They need financial investment. They need donations. Anyone that, if you're not going to go shopping this year, if you could go to Toys for Tots and make a donation, they'll go out and buy the toys. Obviously, the girls are always a big issue. Older kids are an issue. You can contact Toys for Tots as well. I'm going to talk about it a lot here at the press conferences, but we're asking anyone to be helpful. These guys and men and women are amazing people. They generally don't ask for anything. They just give. They give their life to our country, and they support us, and that's what they do. And they're not good at asking, but I'm asking for them, on behalf of them, to everyone to please help this organization. This is a different year. Usually, every year at the end of the season, Toys for Tots, the news stations thank you. You run kind of like a story because they're low on toys. It's December 2nd. They'll go low on toys, and they're going to be low on toys the entire time because of the year that we're in. So we're going to ask you to continue to promote this. So thank you very much.
Thank you.
Good job.